Jamie Jenkins is here with us, our favourite statistician, formerly, of course, from the ONS, political commentator as well. Jamie, very good morning to you.
Good morning, Mike. I think watching the kind of government briefing in the pub is probably the best place to be, I think, watching it yesterday.
I kept waiting for something interesting to happen, and it sort of just didn't. I was sitting with a couple of guys from work, and I said, "When's this going to get? When's he going to say anything that actually means anything?" There was nothing really in it at all. It was literally the most boring and dull series of statistics rolled out I think that I've ever seen, and it's got some pretty stiff competition.
No, I think so, Mike. Normally, when they call these press conferences, is to make an announcement. I'm not sure if this was to kind of rebut a lot of the media, and then you've got kind of the people who are for these kind of lockdowns calling for Plan B. So why don't we just start with Plan B, Mike?
Yeah.
Because obviously, Plan B is vaccine passports, working from home, mandatory masks. Now, I live over the border in Wales. We've got practically all three of those. We've got slightly different to the vaccine passports, where you've got vaccine passes where you can kind of show a lateral flow test that is negative. But ultimately, Wales has Plan B. Wales has higher cases than England. Cases are slightly rising in Wales over the last few weeks. So I think all these people are saying, let's get Plan B in England. I don't think it's going to have a significant impact, Mike, in terms of when you look at the data from Wales.
No. Well, the one piece of data that I didn't hear yesterday from Sajid Javid, I heard this morning from Paul Bristow MP, and I don't know if you were able to hear what he said, but which is that the number of deaths is so much lower right now than it was back in January, that the number of people in hospital or the increases in the number of infections is kind of irrelevant.
Yeah, so let's talk through the numbers then, Mike.
Yeah.
Let's look at the hospital figures to start with. So we currently have about 6,300 patients in beds in England with COVID.
Right.
Now, at its peak in January, it was over 34,000. So, you're talking 6,000 versus 34,000,
So
less than a
six
fifth of the
times
total.
more, yeah.
Yeah, less than a fifth of the total. Now, remember as well, now NHS England have started publishing some information that's been called for, which is looking at how many patients are in hospital, test positive, but not in for COVID. And about a quarter of those patients, those 6,000, are in hospital, not for COVID, but they've tested positive because obviously it's spreading through the community. So we've got about 4,500 patients overall. Now, patients in mechanical ventilated beds, they're the more serious ones. Again, we've got 746 of those at the moment. It's less than a fifth of the peak that we had. And I think the more important figure we need to focus on, Mike, really, in terms of is the NHS going to be overrun, is that if we just look at the latest data that we had a week ago, we've got 88,000 beds in the NHS overall. We've got 4.7% of them had COVID patients in. 89.6% of them had non-COVID patients in, but we had more empty beds in the NHS last week than we had the whole number of COVID patients. Yeah. So
See,
these are the
this is
things
why
that
we get
don't
you on,
get
Jamie,
talked about.
because you're the guy that tells us what's really going on. And why don't we hear any of this from the government?
Well, I think part of it, Mike, is because there's all this kind of the scaremongering. They're worried now. We have seen a rise in cases over the last couple of weeks, but they're still below kind of July's peak.
Well, yeah, but
People in
let's forget about the cases word. Let's say we've had a rise in the number of people testing positive, shall we?
Well, that's true, Mike. Actually, yeah, we've got and the good thing, I suppose, with regards to looking at the positivity in terms of the numbers, is the vaccine clearly does have an effect. I think the UK would get more out of the booster vaccines for kind of the vulnerable people, because we have seen now that nearly half of over 80s in England have had a booster vaccine. The evidence from Israel, Mike, is that the booster does help with these, especially among the vulnerable people. And we've seen the cases that have been rising in older people, kind of the increase in cases has kind of slowed down. So I think you're going to get more from the booster rollout for vulnerable people. I'm not saying to vaccinate the whole population again, but for the vulnerable people, because remember, Mike, we still know that over 82% of all the deaths in the UK are people over the age of 70. And a figure that gets talked about, I think that's why the UK now is on some banned list for some foreign countries again, is that we get in all these cases in the UK now compared to Europe, but we test far more than the rest of Europe. So
well, that's my worry, right?
Back.
Because my sort of nightmare scenario is thanks to this ridiculous testing regime. We will once again become the sort of plague nation, and places like the United States of America, where I'm planning to go see my mother, are going to say you can't come.
I think exactly that, Mike. And if you actually look at the death figures, Mike, just for some context, the UK is currently running about the same as the EU level. We look like we're really bad compared to the EU because we're testing loads more, but the number of deaths aren't the thing. So I think, Mike, when you look at the figures overall, let's not just focus on cases. Let's look at deaths. Deaths are considerably lower, about 90% lower than what they would be. I think some people have forgotten in the NHS, or the people who are calling for all of these extra restrictions, is this time last year, things did get pretty bleak. Cases did rise around this time last year, but we didn't have a vaccine. We were told, let's have the vaccine rollout. The vaccine clearly does have an effect. They pushed vaccines out to children. I know there's been a low uptake from that. I don't think we need to be vaccinating the children. We've got the booster vaccines. You can't keep saying vaccinate, vaccinate, vaccinate. And Mike, this is an important figure, I suppose, is that why are we in this position? Well, we give 150 billion a year to the NHS. We've given an extra 62 billion in the last year for COVID, but we still ended up in a position, Mike, where there's about 246 beds for every 1,000 people, sorry, for every 100,000 people in the UK. And it's over 800 in Germany and over nearly 600 in France. So we're giving all this money to the NHS, but we're still in a bleak position compared to these countries. So
yeah, but from what you're saying, we've got a load of empty beds right now, so we don't really need any more beds, do we? We just need a better run NHS. I mean, that's what we need, because one of the reasons where they were worried the beds were going to run out, which they never did, by the way, is that they took a third of them out for social distancing.
Yeah, and again, that's another issue, Mike, isn't it? Taking these kind of beds. So we've got fewer beds now than we had at the start of the pandemic, in particular because of all of that. But I think, obviously, you've done your calls. Germany moved away from saying that, looking at cases several months back now, Mike, to say we're going to look at the impact on our hospitals. And the chances of the impact on Germany is going to be pretty low because they've got a lot more beds. But you're right, we've got empty beds at the moment. I think people are concerned that, if we do get 100,000 cases a day, the NHS won't be able to cope. But I think, again, Mike, that's where the vaccine comes in, because say we did hit 100,000 cases a day, and if you just look at the number of admissions now in relation to cases, well, we probably have about 1,700 admissions a day. And again, that's below the peak of winter. And we managed to survive last winter. I think the biggest issue, Mike, we've talked about it previously, is, if you go back 2018, 17, 16, 15, 14, every year, media, newspapers, they're always in front of the Guardian, the NHS is overwhelmed, we can't cope. That is the biggest problem.
I mean, that's what we get I'm sick to death of hearing it, because it wasn't overwhelmed last year. And if it wasn't overwhelmed last year, it never will be, right? So it has the capacity. It has perfectly capable needs to be filled. There's nothing that we need to give them extra. And all we have to do is make sure that they run the organisation properly. It's really that simple, isn't it?
No, exactly that, Mike. I think, a root and branch review of the NHS. I think, the MP on just now was talking about looking at the structure of the management in the NHS. It must be, clearly bureaucracy going mad with regards to the budget. It's a huge amount of money going into this, Mike. And it's not just the kind of the hospital side of things. We've talked about the GP side of things. I think the important thing to remember, all those people calling for Plan B, if we did implement Plan B, they won't be happy with that. They'll be calling for Plan C, D, E.
Well, also all this cobblers about, just get the very last thing we need to do is get the booster jab. Well, really? Are you sure? Because if that's the case, and they reckon that these vaccines have a shelf life, then presumably in sort of, I don't know, April or May, they're going to say, get another booster.
No, we can't keep kind of jabbing people forever, Mike, with regards to all this. If you're vulnerable, getting the vaccine clearly is the way forward. And the flu vaccine, the death rate from COVID is looking similar to the flu now, and we don't force the flu vaccine on everybody. I think ultimately, Mike, some people will never be happy until we've got kind of lockdowns back in. We've had the vaccine rollout, very successful. Get the booster if you're vulnerable, and in regards to all of that, let's not just look about cases. Let's look at the hospitalizations and deaths, and things aren't as bad as what being painted by many of the national media outlets. And Mike, as soon as the questions come up, as soon as the questions come to the Sajid Javid yesterday, the journalists in the room are all kind of saying, well, why aren't we going to go into lockdown? The same things that happens in Wales, Mike. As soon as we have the next briefing, they'll be saying to Mark Rayford, why aren't you locking down? I think the important thing here is the data showing that the vaccine's clearly having an effect. Things aren't as bleak as what is being painted with the rest of Europe, because we're testing a lot more, and we have got some capacity in the NHS.
Yeah, there's absolutely nothing to be concerned about as far as I'm concerned. Jamie, great to talk to you. Thanks very much indeed. Jamie Jenkins, independent statistician there, giving us the real figures and the real reason why that we're not anywhere near having to have more restrictions or have any kind of lockdown, because quite frankly, there's no requirement for it. It's that simple.